Hello. Welcome to Kindly Neurodivergent with Kay. This show is to spend quality time with each other, kindly discussing the similarities and wide range of differences we experience. The experiences we discuss on this show are for educational purposes only. Please do not substitute for professional medical advice, diagnosis, or treatment. Before we begin, I respectfully request that if you witness any pauses during this show, please continue watching. I'm composing a spontaneous comment or question, someone processing their thoughts, in addition to repeating something that was unintelligible or misunderstood. It is natural discourse, and we can choose not to say anything while this is occurring. Today I have Whitney Bailey with me. She is here to discuss how the Baclofen pump has increased her independence. Whitney Bailey is a fierce disability advocate, fluent in sarcasm and sass. She has made a career by advocating for others to ensure they get the resources needed to thrive. Welcome, Whitney.
Hi, thanks for having me, Kayla. Yeah.
Please introduce yourself.
Well, like Kayla mentioned, my name is Whitney Bailey, and um, I, like I said, like my bio says, I'm fluent in sarcasm and sass. I have a social media presence. It's wheelchair wit, and I, uh, I, I work in the disability sector as um, I've worked in the disability sector for quite some time, going on probably 12 years. I may look young, but I am 34 years old. I like to preface that because people think I'm quite young, but I'm not. And I got a Baclofen pump when I was 18. So I went from having to rely on a caregiver to do almost 100% of tasks for me to being almost completely independent. And then I will let go. And thanks for letting me introduce myself, Kayla.
I'm 26 years old.
See, we can relate because you don't look 26 either.
Why did you choose this treatment for spasticity?
Um, well, it was thinking back that long ago. I believe it was a suggestion. It was just it was a brand new treatment for people with cerebral palsy. Um, back then, and it was suggested by, I believe, my physical therapist, um, for my spasticity because I had pretty severe spasticity because I have a quadriplegic spastic cerebral palsy, so all four of my limbs are affected. You too? Yeah.
Was your family and/or team against it?
Oh no, they were totally for it. We didn't know what the outcome was going to be, but oh, they were totally for it.
Were you always tight, or did puberty and/or other things affect your spasticity?
Oh no, I was always tight. I've always been very spastic.
Did spasms cause you pain?
Oh yes, and they continue to do so. Because a misconception is that Baclofen eliminates all of your spasticity, and I choose to keep some spasticity because it helps me function on a daily basis. So yeah, but my spasticity does uh, it did and still does cause me pain, like, especially in cold weather, like like January. We're experiencing cold weather is the worst. I hate it.
How does some spasticity help?
Because that's what I'm used to. Like I've always had spasticity, like we mentioned. It gives me it gives me some resistance to do my everyday movements, if you will. Like if I'm too loose, I don't know how to I don't know how to function, if that makes any sense. I'm just like a floppy mess. So I have to have some spasticity to be able to function.
Interesting.
Yeah. Hmm.
Was the decision hard?
I don't know, like I said, my physical therapist sold me on it.
Why is it better than oral medicine?
Because oral medicine has to go has to go through your entire body when you take it. With the pump, you have a catheter, and they choose the level of your spine to put it in, so it goes directly to your spine instead of having to travel through your whole body. Like for instance, my catheter is in the I believe it's like C4, C6 area because they wanted my arms and my hands to be the most affected. But yeah, but with the oral medicine, because you take the oral medicine first to make sure the baclofen is gonna work for you. And with the oral medicine, like I said, it has to go through your entire body, and like it wears off pretty fast. Like you have to take, I believe I have to take it 3 times a day. And so with the pump, you don't have to take anything. So hopefully that answered your question.
Does it help other movement disorders?
I believe it'll help anyone with spasticity, and the 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 cool thing about Baclofen is it's not just for cerebral palsy. It's they use Baclofen for people that are recovering from like alcoholics. So one thing about Baclofen they is that if you drink, you're gonna get drunk really fast. So depending on the level of baclofen that's in your system. So I choose my baclofen dose is very high. So I made the personal decision to not drink alcohol because I will get wasted off of like a half a drink. So I made the personal choice to not drink alcohol. But baclofen is I believe,
Good to know.
yes.
How do you qualify for the pump?
You do a trial. Like I said, first they'll put you on. Um, you go to a neurologist, and they'll put you on baclofen if they see fit. Like they'll put you on the oral medication, and then if the oral medication's working for you, you'll do a baclofen trial, which is where they'll give you a direct shot of baclofen through your spine, wherever they choose to do it at. And if that takes a couple hours, and if that works, and they see progress, then you will move forward with the baclofen pump. And again, all this might have changed a little bit throughout the years. Like I said, I've had my pump for like almost 20 years.
How long do you have to try either of these?
Can you can you re can you say the question again?
How long do you have to try either of these?
Um, I I I don't really remember. I think you have to be on the oral medicine at least, I want to say at least 6 months. And the trial is immediate. Like they'll know like by the end of that day. You have to stay in the hospital for a couple hours, like to let it wear off. But the trial is instant.
Is it painful?
Um, the trial is not painful. They hold well my neurosurgeon put me to sleep. So it all depends. So that was what they did for me. I can't say what they'll do for another person, but for me it was not painful.
Did you get waken up to see if it worked?
The trial, yeah, yes, like they did the injection, and then like I said, they'll like I stayed there for probably half a day to make sure that it works. Like so yes, they wake you up.
How do you describe the drastic difference in spasticity other than independence gain?
You just get yeah, the one word that comes to mind is like a relief. Like right now, for instance, I'm just giving this as an example. Um, I have a refill on the 30th of this month, so January 30th. So right now I'm a lot tighter because you have to gradually increase your baclofen over time. And right now it's time for me to do an increase. And if and for those of the like my family and friends that know me, they can tell that I'm getting very tight because it's harder for me to talk, and my pain is just very high right now because of the winter. So
Sorry, I couldn't find that in your home.
Siri, I was not talking to you. Sorry, sorry. Um, but but yes, you have to. So you have to gradually increase. But but I'm sorry, Siri messed me up. I don't know if I answered your question or no.
What are your withdrawal symptoms?
The withdrawal symptoms are um extreme spasticity, like extreme. And then I believe it's itching, um, like delirium if it's really bad. Um, the 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 telltale sign is like extreme extreme spasticity. I think, don't get me wrong, I've only went through withdrawal once, and it was like a long time ago, so I can't really remember the withdrawal symptoms, like all of them. But when you start feeling bad, like you sort of know when it's when you're going through withdrawal, when you're
When do you start noticing it?
it just depends. Like it depends because like anything can send you through withdrawal. Like if you get if you get a nick in your catheter for whatever reason, um, like like anything can happen. So there's not like a telltale sign.
Interesting. Do you have to get other treatments continuously to ensure that the medication works?
You just have to get it you have to get it filled depending on your dosage. It could be every 3 months. Mine's pretty high, so it's every like every mine's my dosage is pretty high because you have to gradually increase, like I said. So mine's like a month and a half to every 2 months, and it's and then physical therapy, like every physical therapy if you choose. Um, it's all there's I believe there's other treatments that would go along with it. You just have to get the best plan from your doctor and your team and your medical team.
Do they reschedule your refills for the year?
Not not for the year. They go by they go they schedule it like one by one. So if you increase, they'll schedule sooner. But yes, it's pre-scheduled, but not for the entire year.
Oh, wow.
Yeah.
Do they do a pre and post-op appointment every month?
No, no, it's just 1 month or it's just one appointment to get you filled. And if you start feeling worse, like you can always call your doctor and they can adjust your dose as needed. It's not like a but it's not like a scheduled thing.
Do you have side effects?
Say that again.
Do you have side effects?
Oh, side effects? Um, no, there it's all it's all positive side effects until I'm like super tight. I need to go up on the pump but for me it's all positive so far. Like I said, but besides the fact that I need to go up and I'm like super tight.
You were in the hospital for a week. Initially, how many days were you expected to be hospitalized after the surgery?
Well, after the surgery, you have to lay flat on your stomach for 3 days, and then and then you're there for initially a week, and then other than that, it's all up to your care team on what they want to to do. So, a cool fact about me is that I got the pump when I was a senior in high school, and and I I got the pump, and then I I did my hospital stay, and then I went to physical therapy pretty much every day after that. I was able to walk across the stage at at my high school graduation. So I went I went from I went and I might get emotional, so I'm sorry. I went from having to rely on a caregiver to do everything for me to being able to walk across the stage at my high school graduation. And my my thank you. And my physical therapist that helped me through all this, he was with me until I was 3 years since I was 3 years old, and he tragically passed away like a week like a month after my graduation. So I was with him. I was with him every day for a month, working my butt off to accomplish this goal, and then he ends up passing away. So I was so thankful for that time that I had with him. Even though I knew him since I was 3 years old, and but he knew exactly how I was. He knew I was stubborn, and he knew how to push me. So I don't think if he wasn't there to help me go through all this, I don't think I'd be as independent as I am.
Sorry for your loss.
Oh, thank you, Kayla. And can I add something real quick? Oh, say that again.
How does the refill work?
Oh, you get you have to you have to get a shot in the stomach, and they drain what's left what the residual that's left in your pump, and then they fill it with new medicine.
Why can't they refill through transfusion?
I have no idea. I'm not a medical professional. I can't answer that. I can't answer that. I would think it's because the pump sits on it, so it sits in your stomach, and then it's like the catheter, it's connected to a catheter, and it goes directly to your spine. So I would guess that's why. I'm not sure.
How long do you have to recover from the refill?
Oh, you don't need to recover. It's a, or for me, I don't need to recover. I can go on about my I can get it filled and then go on about my day. They do use my doctor that does it right now. He does use lemon cream on my pump, but I've had it where other physicians do not. So it can be a little painful if they don't use lemon cream. It's just like a shot in the stomach.
You don't feel drained afterwards.
You won't feel the immediate side effects. If it's too much, if they increase your Baclofen that day, you won't feel the side effects for a couple of hours, so you won't know how you feel for a little bit. And if they went up too much, like I said, you can always call your doctor to go in and adjust the medicine.
Does it shock you?
No, or at least for me, no, no, because I don't, because again, I don't get rid of my spasticity, like I don't like, I still want spasticity, so I don't go up, I don't go up a lot. When I do go up, I go up just a little bit.
Have you seen the development of scoliosis from it?
Oh no.
I haven't pursued any of these. A lot of factors go into how tight we are, like hormones or stress. I have made so much progress naturally, even though I use a wheelchair. I used to need my parents' help to do homework every night, but as the material got more involved, it's easier for me to do it independently rather than explaining it to someone except for math. Every time I see my neurologist, adding spasticity meds come up, but I'm always like, what's my normal? In 2016, my left leg brace kept breaking and I started getting blisters repeatedly. We went to the orthotist and a physiatrist referral was made. My high muscle tone was making them break. The physiatrist of course offered the CP treatments that I can't imagine doing. So the orthotist made me a new brace with an extra smaller piece to put on before I put my left brace on.
That's awesome. Like I said, everybody's everybody's journey is different. Like I said, the Baclofen pump worked for me. I did Botox before Baclofen pump, and Botox did not really do anything. Um, but I'd like to mention that I have I have the three other siblings, and one being a twin, and I was the only Bailey kid who who went off to college and not only got a bachelor's degree but a master's degree, and I associate um I associate that with sort of the Baclofen pump journey because the Baclofen pump made me so independent, but it's also like my mindset. But I just wanted to throw to throw that to throw that in there, toot my own horn, if you will.
Yeah. What do they tell you to be cautious about with the pump, like pants?
Um, you you can't like I believe your pump will set a will or can you say that question again? I want to make sure I answer it correctly.
Yeah. What do they tell you to be cautious about with the pump, like pants?
Like pants, is that what you
Mm.
oh, with the pole, with it sitting on my, with it in my stomach like that, with it in my stomach like that. Like you don't really have to be like conscious of anything like that. It also depends on how much you weigh and how 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 because if you don't weigh a lot, the pump is going to be more exposed. Um, but the pump, but I have lost a lot of weight since getting the pump, or since I've I am it's a weird situation. I was I was 90 pounds when I got the pump, and oh, cool. And then, and then I went off to college and stuff. And Baclofen does help you gain weight, or it can help you gain weight. I gained a lot of weight, but that could probably be because I was in college and eating the wrong foods. And maybe partying a little too much. Uh, and then but I'm back down to like a smaller weight. So um, so like I said, baclofen can affect your weight. But it shouldn't affect like any clothes or anything unless you're like significantly like underweight, I would think. But I'm not an expert, so don't quote me on that.
I would think that it would help gain weight.
Yes, it does. Or it can.
You had to rely on a caregiver before. Please talk about that and the independence you saw as soon as a week post-op.
Like I said, before I got the pump, I had to rely on a caregiver for everything. Um, like from showering, from getting in and out of bed, going to the bathroom, getting dressed, pretty much every aspect of daily living. And I can't, like I said, this I got the pump like almost 20 years ago. So I can't really remember a week a week post post op, but I do remember that I I felt a lot of relief from my spasticity. Like it was I didn't realize how much pain I was in from spasticity till my spasticity was reduced significantly, if that makes sense.
What do you wish you knew before you decided to pursue this?
Um, I don't really have an answer for that question. Um, because I was so young and it was I got it so long ago. I don't really have I can't really think of a of an answer. Like I'm just a huge advocate for it. So if there is any cons, the pros outweigh the cons.
What would you hope everyone knew if considering it now?
That just because it works for one person doesn't mean that it's going to work for you. So just because I had extreme success with it does not mean that you're gonna have the same success. If that makes sense. So
Did you skip refills during COVID?
oh
If
no, you
how
can't
did you manage?
you can't skip refills like you there's no skipping refills. Like you have to get it refilled or you'll go through withdrawal. because because there's only so much medicine in your pump, and you can't go without it. I'm sure they could put you on oral medicine if they absolutely had to, but again, the side effects will be different because the oral medicine is not as strong as the pump, like going through the back of it going through your catheter.
Thank you, Whitney, for doing this with me.
No
It
problem.
was great to have you on. Please
No,
share this talk show with your family, friends, and colleagues. Everyone watching, don't forget to like, follow, subscribe and share on Facebook, Instagram, and YouTube.